Welcome to Gyno Curious. I'm your host and creator, Dr. Amy Novatt. Here on Gyno Curious, we investigate what it means to be a healer and to be healed by exploring women's health from both sides of the speculum. I always love hearing your thoughts, so please share your comments by emailing us at comments@radiofreerhiniecliff.org. And to learn more about my clinical practice, please visit dramynovatt.com. So every so often, medical societies release new guidelines, fresh science, and updated recommendations on issues we see regularly in practice. These guidelines serve as valuable tools for both clinicians and patients, helping to unify understanding and support shared decision-making. Today, I'm doing something new. I'm going solo to talk to you about the latest 2025 guidelines on a topic I've mentioned to you before on Gyno Curious, the Genitourinary Syndrome of Menopause, or GSM. These new evidence and consensus-based recommendations are designed to help clinicians identify, diagnose, counsel, and treat GSM, ultimately improving quality of life for women experiencing these symptoms. And while there is some science guiding these recommendations, it's critical to remember every woman's experience is unique. Your journey through perimenopause and menopause should be addressed with individualized care. These guidelines are not one size fits all. They are tools to support you and your clinician in making collaborative, thoughtful decisions based on your specific needs, knowing those needs may actually evolve over time, day to day, week to week, month to month. So what is GSM? GSM refers to a broad collection of symptoms and physical changes that occur due to the decline in estrogen and androgen levels in the vulva, vagina, bladder, and urinary tract during and after the menopause transition. Symptoms can include vulvovaginal discomfort like dryness, burning, itching, and irritation, urinary symptoms, issues like urgency, frequency, pain with urination, and recurrent urinary tract infections. Sexual symptoms like painful sex, which we call dyspareunia, bleeding during intercourse, reduced libido, arousal challenges, and decreased orgasmic response. And visible changes that you might see and your clinician might see: thinning labia, reduced vaginal moisture, narrowing of the vaginal opening or introitus, and clitoral shrinkage. These things are not subtle. So it's important to know that the severity of symptoms doesn't always match physical findings. Some women feel significant discomfort with little visible change, and vice versa. So why do these guidelines matter, you might ask? Because GSM affects an estimated 13 to 87% of postmenopausal women, depending upon the population studied. That is a huge number, and many women are suffering silently. Too often, these symptoms are minimized as just aging. And I'm here to tell you, discomfort is not a normal part of getting older. Please, discomfort is not a normal part of getting older. It is not just because you're aging. If your clinician isn't addressing these concerns, speak up or seek another opinion. Your symptoms matter. Your comfort matters. And your relationships and sexual health matter. These new guidelines, developed by the American Urological Association and endorsed by the International Society for the Study of Women's Sexual Health, the Sexual Medicine Society of North America, and the Menopause Society, are designed to bring more clinicians into the conversation, especially those in underserved areas or outside gynecology and urology. These guidelines emphasize the need for 1, routine screening for GSM, 2, pelvic exams when symptoms are present, patient education on how hormone loss impacts genital and urinary health, and referrals to sex therapists or pelvic floor physical therapists if they're needed. Treatment options outlined in the guidelines include vaginal estrogen, cream, rings, or suppositories, because vaginal estrogen restores estrogen in local tissues. It helps relieve dryness, irritation, bladder symptoms, and pain with sex. Another option is vaginal DHEA, a suppository of dihydroepiandrosterone, just in case you're wondering. This is a hormone that's typically made by the adrenal glands, and it converts to estrogen and testosterone in vaginal cells. It also improves dryness and sexual discomfort. Another option for those of you who might not like the stickiness and messiness of vaginal products might consider oral osfenofine. This stimulates vaginal estrogen receptors, thus reducing dryness and dyspareunia. Again, an oral medicine. And then there are the over-the-counter products like lubricants and moisturizers. Moisturizers restore hydration and the pH of the vaginal tissue, and lubricants, whether they're water, silicone, or oil-based, provide comfort during sex. So the other guideline that I thought was really interesting that they included was that they speak to avoiding irritants, like skipping harsh soaps, douches, and perfume products, which typically exacerbate GSM symptoms. Remember, vulva havers, your vagina is not dirty. And for so many years, my colleagues would talk about douching and anti-this and anti-that products. Please, please, please treat your vagina and your vulva nicely and simply and naturally. Water, water, water. So at this time, the guidelines do not support the routine use of vaginal or systemic testosterone. The American Urological Society suggests that more research is needed, though I must say we are using testosterone more and more, so please speak to your clinicians. And laser and radio frequency devices, they're out there on Instagram and in other publications. There's insufficient evidence right now that they in fact treat GSM, but please, they also may be considered if all other treatments fail. Also, there are a cohort of women out there who are concerned about the use of hormones because they've had breast cancer or the risk of getting breast cancer, endometrial cancer, or any hormone-sensitive condition. Studies have shown very conclusively that vaginal estrogen, vaginal DHEA, and osfenofine do not increase these risks. Still, always discuss your options with your clinician so that you can feel safe and educated about all your choices. Remember, these are guidelines. These are not necessarily what you need to do or what you shouldn't do. These are guidelines to speak to your clinician about. I'm not telling you what to do here. I'm just alerting you to these new guidelines. So there's a lot of information to absorb. I know. But here's the bottom line. 1, you're entitled to feel good down there. 2, you deserve to live without discomfort, shame, or silence. And 3, you have options. The 2025 GSM guidelines are a powerful step forward in recognizing a common condition that has just too long gone undertreated. Please, please, please bring up your symptoms, ask questions, and advocate for care that supports your full, vibrant health. I want to remind listeners that this podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The information on this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Thanks always for being here with me, and I want to thank the Epicurean for hosting Radio Free Rhiniecliff. If you've never been here, I would recommend you come and explore all the delicious, wonderful local items that they sell here, and to Patricia Wind, who just so generously supports Radio Free Rhiniecliff and the community of all of us podcasters. I also want to thank David Hoffman, my editor, and to my co-producers, Matty Rosenberg and Jen Hammoud, and particularly to Jen Hammoud, who's sitting in the radio station with me today, despite the heat. I'm so grateful for everyone who's listening to Gyno Curious. Please stay curious and be kind to yourself and others. And always, always trust your instincts and intuitions. They are your greatest teachers, not to be ignored. Until next time, please be well.